Canine influenza, commonly known as dog flu, is a contagious respiratory illness caused by specific strains of the influenza virus. It primarily affects dogs and can lead to mild to severe symptoms, including coughing, fever, and lethargy. Understanding canine influenza is significant for dog health as it can spread rapidly in areas where dogs congregate, such as shelters, dog parks, and grooming facilities. Early detection and vaccination are crucial in preventing outbreaks and protecting canine companions from complications associated with the disease. Canine influenza virus, civilian, is a contagious virus that causes respiratory illness in dogs. First identified in 2004, civilian is primarily classified into two strains, H3N8 and H3N2. It's important to note that these strains are distinct from the human influenza viruses. Transmission occurs through respiratory droplets, direct contact with infected dogs, or contaminated surfaces. Symptoms can range from mild to severe and may include coughing, fever, nasal discharge, and lethargy. Vaccination is available and recommended for dogs in high-risk environments to help control the spread of this virus. Canine influenza, also known as dog flu, is a contagious respiratory disease in dogs caused by specific strains of influenza virus. Common symptoms include a persistent cough, which may sound dry or wet, indicating irritation in the throat or lungs. A fever is another frequent symptom, which can be accompanied by lethargy, reduced appetite, and nasal discharge. If your dog exhibits these symptoms, it's essential to contact a veterinarian for proper diagnosis and treatment. In addition to common signs of illness, it's crucial to observe for other symptoms such as nasal discharge and lethargy. Nasal discharge can indicate respiratory infections or allergies, suggesting that the body is fighting off something. Meanwhile, lethargy, characterized by a lack of energy or reluctance to engage in normal activities, can be a sign of underlying health issues. Both symptoms, when present, warrant closer attention and potentially a consultation with a healthcare professional to rule out serious conditions. Canine influenza spreads primarily through respiratory droplets when an infected dog coughs, barks, or sneezes. It can also be transmitted via contaminated surfaces such as food and water bowls, leashes, and even clothing that has come into contact with an infected dog. Close contact with infected dogs, particularly in crowded settings like parks, kennels, or dog shows, significantly increases the risk of transmission. It's important for dog owners to monitor their pets and maintain good hygiene to prevent outbreaks. Early detection plays a crucial role in managing diseases effectively. Identifying health issues at their inception allows for timely intervention, which can significantly improve treatment outcomes. When diseases are detected early, patients often experience a wider range of treatment options, potentially less invasive procedures, and better prognoses. Furthermore, early detection can lead to lower healthcare costs over time, as it prevents the progression of illness, reducing the need for more complicated and expensive treatments down the line. Regular screenings and awareness campaigns are essential to promote early detection, ultimately saving lives and improving the quality of life for individuals affected by various diseases. Vaccination for canine influenza is essential for protecting dogs from this highly contagious respiratory virus. There are two primary vaccines available: the bivalent vaccine, which covers both H3N8 and H3N2 strains, and the H3N2 vaccine, targeting just that specific strain. Vaccination is recommended especially for dogs that frequent daycare centers, dog parks, or have close interactions with other dogs. It's vital to consult with your veterinarian to determine the best vaccination strategy based on your dog's lifestyle and risk factors. To limit exposure to potential health risks in dog parks and boarding facilities, it's essential to implement various preventive measures. Owners should ensure that their dogs are up to date on vaccinations and regularly checked by a veterinarian. Training pets to avoid contact with unknown dogs can also minimize disease transmission. Additionally, selecting dog parks with proper hygiene standards and ensuring that the environment is clean and safe is crucial. Monitoring your dog's behavior for any signs of distress or illness while at these facilities is another important step. Finally, establishing a routine for washing your dog after visits can help reduce the risk of bringing home any pathogens. Maintaining a healthy environment for your dog is crucial for their well-being. Start by regularly cleaning your home to remove dust, pet hair, and allergens that could affect your dog's health. Ensure your dog has access to fresh water and quality food. It's also important to provide a safe outdoor space where your dog can exercise and play. Consider using non-toxic cleaning products to avoid harmful chemicals that could affect both your pet and the air quality in your home. Lastly, regular vet checkups and vaccinations are essential to keep your dog healthy and to catch any potential issues early on. In conclusion, while it's essential to gather information about pet health and behavior from various sources, nothing compares to the expertise of a qualified veterinarian. They have the training and experience needed to provide tailored guidance that aligns with your pet's unique needs. Whether you're noticing unusual behavior, have questions about nutrition, or are considering vaccination options, don't hesitate to consult your veterinarian. Their insights can be invaluable in ensuring your furry friend lives a healthy and happy life. Remember, a proactive approach to pet care today can prevent more significant health issues tomorrow.